Hello everybody, James Woodall here, and today I'm talking about settings for health promotion. So ideas like healthy schools, healthy workplaces, health promoting prisons. So I'm going to talk you through what all that means, what some of the benefits are of working in settings and what some of the challenges might be. So let's get stuck in. Okay, so just a very brief history lesson about the settings approach in health promotion. It derived really from the Ottawa Charter, and in a previous video clip I talk a little bit about what the Ottawa Charter was all about. Now in the Ottawa Charter it talks about health being created in the settings of everyday life, and that's very true because in most cases I spend most of my time in places like the workplace, in the home and community setting, and what the settings approach was about saying, hey, let's harness these opportunities that are present in people's lives and let's use that to improve well-being and to reduce health inequalities. Now there's been lots of international endorsement for the settings approach. So if you look back through WHO documents on health promotion, going back to the Ottawa Charter, the Jakarta Declaration, the Bangkok Charter, and so on, there's been lots of commitment around the settings approach. So it's very much in vogue, very fashionable to talk about settings in health promotion. And that's really why, because it is about harnessing that everyday life experience that people and communities interact with on a daily basis. So let's talk a little bit about what the settings approach is all about. Now there's lots of specific examples out there that you will be familiar with. Healthy schools, healthy cities, healthy workplaces, healthy prisons, healthy universities, healthy marketplace. There's lots of examples of settings in health promotion. And I think one of the unifying concepts of the settings approach is that it's not just about targeting individuals who happen to be in that setting. It's about thinking more about holistic setting and thinking about policies, about structures, about architecture, about all of these things and how that impacts on people's health. So I think we need to move away from this idea of simply doing one-off health education events in a setting. So often you see that in schools, there might be a one-off kind of health awareness day. And actually the settings approach is much more than that. It's about embedding health and health promotion in the settings ethos so that everything that's done in that setting is geared towards thinking about health and well-being. So in principle, settings are a really good idea for delivering health promotion and thinking more holistically about health promotion. Rather than targeted health education, we're thinking more broadly about how structures and how policies are all geared towards health and well-being. But I think a really interesting point is the extent to which, in practice, this has actually occurred, and some of the difficulties that you can see, for example, in trying to implement health promotion in certain contexts, in certain social environments. So let's say, for example, healthy schools. I think most of us would agree that a school is an ideal environment for improving the health of young people. But let's take that a little bit further and let's talk about health promoting prisons. Now, some people may ideologically feel that, why should we be using resource, promoting the health of prison populations? So you can see how there are some competing tensions between various settings. And I think that's why you've seen the rise of healthy cities, healthy schools, healthy workplaces, and if you like, things like the healthy prison movement, which is something I'm very interested in, has kind of lagged behind, certainly in globally, but certainly in parts of Europe. So I think whilst the theory is very attractive in terms of settings, I think in practice there's a lot of tensions and ideological debates that are had about who is deserving of health promotion in settings and perhaps who isn't. So I think that's one of the big challenges of settings as I see it right now. So there are people who don't fundamentally believe that a settings approach is necessarily a good idea, and some of the critique has been around settings approaches actually increasing inequalities. And the argument goes that, well, some people don't interact in settings. So the unemployed, the homeless, the kid that's truanted from school or the kid that's excluded from school, they don't have the same access to settings as other people. And the argument is that therefore increases those inequalities. The second view is that, again, the theory and the practice, there's a gap there. So the theory of a settings approach is an idea that settings join up synergistically, so that that's all harnessed and pulled together to create healthy environments for people. So for example, on a daily basis I might interact in a kind of workplace setting, a community setting, a home setting, and the idea is that synergistically that should all pull together and improve my health and well-being and make me feel better. And actually in reality we know that probably isn't the case. And I guess the final criticism really is that evaluation has been really patchy on settings approaches. And I think the exception is schools, where there's been developed evaluative frameworks around evaluating the impact of settings in particularly in schools. But if you look at other settings, again I use the example of prisons, there hasn't been any robust evaluation that says that adopting a settings approach in prison really does improve well-being or does reduce inequalities. And I think that's a real challenge for the health promotion community and for academics that are working in health promotion. And part of the problem is that settings are so holistic, so ecological, that makes that very challenging for evaluation and for demonstrating outcomes of effectiveness. Okay, so I hope you found this short video useful. I've tried to talk a little bit about the origins of the settings approach and what it's about, and also highlight some of the key challenges which I and others see for the movement going forward. Please look out for my other videos. Look forward to seeing you next time. Take care.